Hello everybody, today we are going to talk about hypopressives or hypopressive. Hypo means reduction, pressive means reduction of the pressure. The main focus is the abdominal cavity. What increases the pressure in the abdominal cavity? First, abdominal surgeries. For example, this is a great example. In the past, I had appendectomy, they removed my appendix. And I remember after the surgery, my stomach was so distended. It was very hard to breathe. And I remember that was for a long time. And so this is what I'm talking about, excessive pressure. That you cannot, even if you try to bring the stomach in, the abdomen stay out. This is excessive pressure. If you had you went through childbirth, could be normal or C-section, you will have excessive pressure in the abdominal cavity. Also, another thing that's going to increase the excessive pressure is a sedentary life. If you spend a lot of time sitting, the poor diaphragm, I will talk about the diaphragm in a few minutes, is going to contribute to the excessive pressure in the abdominal cavity. Also, just posture, being in a lounge posture, this is going to increase the excessive pressure in the abdominal cavity. How can you tell if you have excessive pressure in the abdominal cavity? So this is very simple. Look at your belly, look at your belly and you're going to say, wow, my belly is distended all the time. That, you try to bring it in and you have to do this to bring it in, but it's always distended. When your abdomen is always distended, no matter what, this means that there is an excessive pressure in the abdominal cavity. Another thing that you can do to know, if, for example, if you cough, when you cough, put your hand here in your abdomen and cough, just cough. What happened? Do you feel when you cough that your abdomen push your hand out? Try again. Okay, so if you feel that your abdomen push your hand out, that means that there is an excessive pressure in the abdominal cavity. So what can you do to reduce the excessive pressure? I'm pretty sure you're going to think, okay, maybe I do sit-ups. But guess what? Sit-ups, after many researches, I am a doctor of physical therapy and I learned just like a few years ago that sit-ups were one of the main issues to produce back injuries. Imagine that all these years that we were teaching our patients, sit-ups and was part of our workout, we found medical research found out that this is not good for the back. This contributes to hernias in the back, tension in the back, produce a separation of the abdomen, the rectus abdominal, that is the muscles that are here. The one that becomes six packs when you do a lot of sit-ups. Okay, so they found out that sit-ups were not good for your stomach. So there is another way to reduce, the excessive pressure. This method is hypopressive. So hypopressive use postures, different postures that activate, actually let me tell you, it's postures that are going to help you to open the rib cage, and it's going to help you to bring the organs that are going down to bring it up. Another thing, what is happening with excessive pressure in the abdominal cavity? With excessive pressure in the abdominal cavity, the diaphragm is, imagine like a tent that goes from the rib cage, your rib cage is here, and goes all the way back to the lower back. It's a tent that the origin is here, in this the sternum all go and hold onto this rib cage and go and attach to the lower back. This tent, imagine, is where the lungs are resting, and also is the ceiling for the organs. So what happened when the diaphragm is tight? The diaphragm is going to reduce the lung capacity. So the lungs that are on top are going to not have enough room to expand. and the organs that they are not going to be able to have enough room also to expand, like the stomach. When we eat, our stomach should be expanding, right? But if the diaphragm is tight, what is going to happen is going to push the organs down. The organs are resting on the pelvic floor. What is the pelvis? The pelvis is here, right? The pelvic floor is here, and the pelvic floor, the word is just so clear. It's a floor where the organs rest. So if the organs are the organs are pushed down by the diaphragm, they are pushing against the pelvic floor. The pelvic floor is going to get weak. So what happens if the pelvic floor get weak? Many things are going to happen here. So examples. For example, when you're doing jumping jacks, when you are running, when you are coughing, when you are just laughing, when you are sneezing, pee comes out. And you go to the doctor, and the doctor said this is normal. Guess what? It's not normal. This is the excessive pressure in the abdominal cavity that is contributing to make the pelvic floor weaker. Okay, so that is why hypopressive is an effective method to prevent these situations. And also because hypopressive works in the posture. Hypopressive is, working a perfect alignment. Perfect, starting from your neck, and then it's like a step by step. You focus on the neck, the shoulders, the chest, the lower back, the position of the hips, the knees. Everything has to be perfect to get the best results during the hypopressive exercise. Okay, so I get a lot of messages like, a pregnant woman can do hypopressive. Okay, this is very important. If you are pregnant, I would say that there are modifications like in everything. You can do everything with modifications, right? Everything. But how do you know about the modifications? Just if you are with an expert in hypopressive, okay? And this is also very important. There are two types of hypopressive. One that is only for physical therapists to train physical therapists and doctors. There is a second hypopressive that is just for fitness, and this focus in personal trainers. Okay, I said very proud that I'm a doctor of physical therapy, and I got the train. I went to Spain and I got certified with Dr. Cafres, that he was the creator of the hypopressive method. So I'm very proud of that, because thanks to that, I can put together my knowledge as a doctor of physical therapy with what I learned from Dr. Cafres, and offer the best treatment, and also not just that, because could be just a way of living, So if, for example, you want to just reduce your waistline, if, for example, you just want to flatten your abdomen, hypopressive can help you out. In my personal experience, every morning when I get up, I go to the bathroom and I do 5 hypopressives. Why? It's first because I feel when I do hypopressive, like my back gets in better alignment. My digestion improve, I always suffer from constipation, and I feel when I do hypopressive, my stomach works better, my intestines are working better. So I love hypopressive also because as a physical therapist, I work with patients, big patients, like I would say, big patients, very big patients, So I have to have a strong core to be able to offer my best treatment and also to protect myself from injury. So for me, it's a reset my body, make it stronger, and be able to offer my best treatment for my patients. So, okay, let's continue with the questions. Another question that I hear is, I have kids, I have organ prolapse. Can I do hypopressive? Yes, but remember, there are 3 types, 3 grades of organ prolapse. So if you are on grade 1 or 2, hypopressive could be very effective, but if you are in grade 3, probably you're going to need surgery. And okay, the next one, like there are many things. That is why it's so important to talk with an expert in hypopressive. So important. And remember, it's a lot of people can say, I am an hypopressive expert, I train here and there, but make sure to pick the right person to train you, okay? Because hypopressive is good if you do it the right way, okay? Okay, another question. Guess what? Hypopressive, if you are dealing with swollen legs, hypopressive is going to reduce that, because why we have swollen legs is because all the pressure is compressing on the lymphatic system, and the lymphatic system, that is the one that drains the excess of fluids in our body, is not able to work. Imagine that. It's such a beautiful method. It's like every day that I do, I love it more. I'm doing yoga, I love doing yoga, and I go to a class, to a studio to do yoga, even a yoga instructor. And they like to work on the core, and they do sit-ups, and always when they're doing sit-ups, I'm doing hypopressives. I know I go and I do my own thing because I know this is very effective. Also, if you're feeling like a tightness in your back, you will feel how everything is stretched out. And hypopressive, there are contraindications, like who should not be doing hypopressive? Pregnancy, if you have high blood pressure, because this method is going to increase the blood pressure. And the other one is hypothyroid. I have a hard time to pronounce that. Hypothyroidism. I could say it in Spanish, hypothyroid. Oh, Dios mío. I don't even remember how to say it. Okay, it's when you have problems with the thyroid. So those are situations that you should not do hypopressive, or look for someone that is an expert in hypopressive, and they could give you the right modifications to do it. It's just, just always think about it. It's very important to learn from the right resource. Okay, another situation that you cannot do hypopressive if you just after postpartum right away. No, you have to wait for the body, give time to the body to heal. During that time, enjoy your baby, do less, just focus on enjoying the beautiful baby that you just have, and don't worry about hypopressive, don't worry about working your core. I would say if you can do it the first 6 weeks, just take a break. Don't do it, because you have the body is actually going back, everything is going back to place. So these, I would say, are the most common questions, about hypopressive. Oh, Diastasi recti. What is Diastasi recti? Diastasi recti is when the recto abdominal that is here, the six packs that many people have, is going to separate. And you see like when they bend forward, when they are lying down, comes out. That, hypopressive is effective. It's very effective for this type of, I would say, clients, because this is just one of the reasons why this, the rectus abdominis get separate could be because lifting heavy, because too much sit-ups. It's very interesting to see this. Why? Because the rectus abdominis get so strong that it's not able to hold anymore, and so it starts separating after childbirth. And if they were very strong, they'd separate too. That is also a way to test, that you can, you lean, like you want to try to do a sit-up. This is just for assessment. And you put your fingers. If the 3 fingers fit there, that's super positive that you have Diastasi recti. Also because hernias, So hypopressive will help you with this. Hypopressive is, like I'm telling you, it's an amazing method. That is why I want you guys, girls, to learn about it. Guess what? If you work out, this is also, I do that too. After working out, if you want to recover the flexibility, because you know during working out the muscles get tight. You do hypopressive and you recover, the alignment goes back in place, the flexibility goes back in place, and the best part, you're going to prevent cramps. You're going to prevent that, that sensation of pain because the lactic acid is there, because hypopressive is going to help you to feel better. Okay, more questions about hypopressive. When is the best time to do hypopressive? I would say, from my own experience, in the morning in an empty stomach. Always go to the bathroom, pee before you do hypopressive, because if you do it with a bladder that is full, you can end up having like a urine retention, and you don't want that. Okay, what else? I'm trying to think what other things. Okay, very important. Drink a lot of water. Drink a lot of water, because hypopressive, it's going to make you lose some water, especially with electrolytes. And for example, people say, but I want just to get my 6 packs. Okay, very important to understand this. 6 packs just happen if you have a percentage of fat in your body fat. For men, is to have just 15% of body fat in the body. For those people, they could be able to get the 6 packs. For women, it's 20% of body fat. So if you are, a little bit more than 20% of body fat, it's very good to follow a diet with low fat diet, right? But remember, it's everything with moderation, right? Low fat diet. The best thing also to lose that fat is to do cardio. So do some cardio, do some physical activity at least 3-5 times a week. Go for a fast walk, something that makes you sweat. That's the way that you're going to know that you're losing fat. Also, I know it's very hard for some people to stop eating some things, right? But you really want to see, this is a sacrifice. It's a sacrifice to lose the fat, So if you love ice cream, put the ice cream to the side and maybe eat a date instead, something sweet. And I know you love pasta, you love breads, but all that are heavy carbohydrates that, they are going to, contribute to increasing the weight and also the fat in your body. So just think about all those things. It's very important to, I would say, decrease the amount of calories in your diet. I'm not a nutritionist, but I'm a doctor of physical therapy, and we are trained in the healthy, how to eat healthy. Okay, so we are trained to what kind of nutrients are going to help our patients and clients to heal. So that is why I have knowledge about this. Okay, so that is why I'm telling you this. Is very important. When you do hypopressive, take your vitamin C, because the immune system is working hard. What else? You're going to sleep amazing. You're going to sleep amazing when you do hypopressive, because you could feel, your lung capacity is going to increase. If you want to increase your lung capacity, you are a diver. Oh my God, hypopressive is for you. It's totally for you. And if you're looking for the small waist, hypopressive is for you. If you're looking for a flat tummy, hypopressive is for you. If you feel like your pelvic floor is weak and Kegel are not working anymore, hypopressive. Ooh. So hypopressive, I'm telling you, I love it. I love it. So I would tell you, I don't just do hypopressive. Hypopressive is just to maintain my core, because let me tell you, hypopressive, it improves the tone, And when you do sit-ups, what happens with sit-ups? You are working in isolated muscles. You are working in the rectus abdominis and the hip flexor. Imagine that's it. What happened with the other muscles? So in the hypopressive, you work in the transverse abdominis. The transverse abdominal is that muscle that goes like a corset and hold let's stabilize our lower back and our trunk. It's just, so when we do hypopressive, that muscle bring everything in, And when are you going to start seeing results? After 6 weeks. Be patient, keep doing it, and you will see results. So please write down all the questions that you have about hypopressive. I'm here to help you. My own experience and my clients, they love hypopressive. They love hypopressive because, they can tell also that the arms get stronger. They love it. They say, oh my God, even my arms feel stronger. Also because we use standing postures. You will feel also the legs getting stronger. But you can combine, what I do? I combine hypopressive with planks. I love planks. For me are such a great workout, such a amazing workout to not, and also I do a lot of standing balance in yoga, because when you do standing balance, you activate your core. So I combine not just hypopressive, I mix hypopressive, I use planks, I use balance exercises, and also the most important thing during the daily life, when I'm squatting to grab something from the floor, grocery bag. Sometimes I do hypopressive. When I go to the bathroom, after a pee, I do hypopressive. After a long trip, after a pee, I do hypopressive. So it's just in like a brushing your teeth. It's like a good to do it, like every day. At the beginning, it's not good to do every day. Why is that? At the beginning, you should be doing it just every other day, because you need time for the brain. There is a little part here called the amygdala, and that carry all the emotions, carry the pain, traumas. And what we're doing at night when we sleep, the amygdala remove memories. So what are we doing with hypopressive is, after hypopressive, we're removing memories of postural habits. We are trying to reset our brain to stand upright. Oh, when you do hypopressive, you will feel like you're taller. Actually, I'm telling you, I'm doing hypopressive with this guy. He had abdominal surgery. The plan was to remove just some stones, but they perfored the stomach. He ended up in ICU like 3 weeks. So when he came, when he was released, he was super weak. So he was getting a lot of muscle spasms on the abdominal cavity. So we did some fascial release, some techniques, like a gentle things, right? But we are doing hypopressives. He is very interesting. After we do a session of hypopressive, he stand up and he lean forward, and he said like he feel more flexible. He told me that he feels he's very grateful person too. So he stand up and he said, oh my God, I feel taller, and he's already very tall. So this is something that I wanted to tell you. And another, this is a client that she had a child, a little bit dealing with incontinence and also Diastasi Recti. We did a lot of, we did hypopressive for 9 months. She told me like the husband was telling her that, wow, your waist looks smaller, your arms look stronger. And she told me that she feel like, the pressure in the organs were less. So this is another good, I would tell, testimony. So I'm telling you, I'm here to help you out. I'm here, like a physical therapist, like your friend, like your instructor, to teach you how to do hypopressive right. Hypopressive, right? And I'm including core, I'm including core, but I do safety. My main word in hypopressive, in everything that I do, is safety first and pain-free. Safety first and pain-free. Why? Because if my patients are dealing with pain, we have to do something else. If they are moving wrong, we have to teach them to do everything perfect. And be gentle with yourself. Everything has to be like, if you want to really get the feedback from hypopressive, you have to do things slowly. In that way, your brain can get the message. And be patient, because it's a fun, I would say like a workout for you. And algo colemo like a lifestyle. Okay, my sweet people, subscribe to my channel. I'm here. I'm very happy to teach you about hypopressive. Here, I think I answered almost all the questions. Feel free to write more questions, concerns. I'm here to answer everything. I love you, everybody. And subscribe to my channel, please. Share this with other people. I am located in California, but I have offered right now an amazing program. Is to start you. Oh my God, my English. Okay, I am ready to start. I have a program of 6 videos, amazing videos to start with you. You can start, to do hypopressive, but it's so in detail. These videos is a step by step, starting from head to toe. And the thing is, a lot of tips about healthy back, healthy neck, healthy hips. So you could love it. It's a simple step. Just sign up in my website, corefityoga.com. Easy, core, our core that everybody wants, a strong core. Fit, because we want all to be fit. Yoga, because I love yoga and I do yoga. I teach yoga, and physical therapy is my passion. So corefityoga.com. Go there, sign up. Get the free video. I have there a free video to, so in that way you understand what is hypopressive about. And if you're interested, if you want more, I am offering a very good deal. 50% off, as a good sale for you to do, to start you with your hypopressive. And you are going to have a private, how do you call? Okay, actually I'm going to tell you more, but just go. Sign up, subscribe to my YouTube channel, share this with your people, and spread the word, because we have the tools, girls, boys. We have the tools. We have the tools to get stronger. We have the tools to have the body that we want and a healthy stomach. We all have the tools. Just we need the right person to walk you through that path, to help you to fulfill your needs, your expectations, your goals. And I'm here for that. Okay, my sweet people, I love you so much. Have a beautiful rest of the week, and I'm going to keep posting more videos about hypopressives. I love you all. Have a beautiful day. See you pretty soon. And don't forget to subscribe to my channel. I love you. Bye-bye.